Okay. Hello and welcome back to Crackin' Up, Conversations with Chiropractors. Today we have Dr. Sarah Bryan with us and we're going to be talking about something a little bit different. My name's Francesca Allison Lewis, I'm the chiropractor at Maidenhead, and here we have...
I'm Sarah Bryan. I'm one of the massage therapists.
Yeah, not just a massage therapist though, as we're going to talk about today. You do a few modalities that we're going to deep dive into and talk about a bit further forward. Is that good for you?
Sounds perfect.
Good. Right, so I'm going to start off with what is myofascial release?
So yeah, I'm massage therapist and myofascial release therapist. Myofascial release is unraveling people, basically. It's hands-on body work. We don't use oil. I sink into the tissue and I will encourage it or listen to it and feel where it wants to go, what direction it wants to move in, and then allow it. So it may be to compress or to stretch. And the fascia is, if we get that model that's on top of the shelf, I can show you the connection.
Absolutely.
Let's do that.
Let me grab that quickly. Here you go.
Okay. So fascia is, thank you, a sort of interconnected 3D web of tissue throughout our bodies. So it's under the skin. It surrounds all the bones and muscles, it surrounds all the internal organs, and it's not like a pass the parcel where you take off one layer and another. It's all joined together, and one bit affects another. So this is just a really basic model of what we call tensegrity, which is that tension and integrity that the body's under.
Okay.
And if I move one set of rods, you see that they all move, but if I squidge it up together like this is someone with a dodgy shoulder or whatever, if I stick those two rods, none of the others move. So that just shows you basically that the whole body is connected. If you think of a living onesie under the skin and throughout the body, I'm working with the onesie, and if I can get the onesie to move around and rehydrate, then all the other structures, the bones and muscles attached to it, will start to move and move back into a better alignment. And this onesie is full of brain nerve. The onesie is full of nerve cells that tell the brain what to do. So hopefully the body will correct what it needs to do and stay that way.
Okay, so put simply, sorting out the root of the problem.
Sorting out the root of the problem, yeah.
Yeah. Okay. That's quite interesting. I haven't actually seen this before. Well, you haven't explained it.
Yeah, there we go.
I might try to explain that to people as well. Cool. Is there anything else you'd like to mention about myofascial release?
That it's a form of, it's a slower therapy. So you would come in for an hour, and very simply, it's being with the body, not doing two. So I'm sort of asking questions rather than trying to make your body do something. And when I do put my hands on, it's not just a physical release. Sometimes it can be quite emotional for people as well, and that is totally okay. The body can start to move in weird and wonderful ways, and you'll probably think I'm moving you around. I'm not. I'm just taking gravity out of the equation. The body does its own sweet thing. It's a bit like witchcraft, and sometimes a lot of emotional stuff can come out as well, and it can be really subtle, or it can be quite dramatic, and that's all okay.
No, I've heard from a few patients that we share as well that they call it quite magical, the way that the body just starts moving on its own.
It starts moving on its own, and one of my clients doesn't know what to call me, so in his diary he puts witch dog.
Yeah. When I refer people to you, she's magical. That's what I call it. Good. So I know that so a lot of people might know what that is. That's probably our main, what we do, well, what you do around here. We've also got sports massage here, but you are quite specialised in other things as well. So should we talk more into scar work?
Yes, scar work's good fun. I like scar work.
It's quite interesting. So I think my first question about scar work would be, who can it help?
It can help anyone who's had an operation. So I see a lot of hysterectomy scars and C-section scars, people that have had other abdominal surgery, bowel surgery, colostomy bags, things like that. Also people have been bitten by a dog, or an ear piercing that's gone wrong, or a bad burn, or even stab wounds. So if you've had a wound that has left a scar that bothers you in some way, whether it's the appearance of it or how it makes you feel, I'm happy to help with it.
That's quite interesting. So it's not necessarily so how you mentioned about surgeries, because those were quite internal. So is it? So when I think of scar work, I think of the kind of superficial, like someone's had a cut or something like that. So you do the internal scarring of the fascia as well.
Yeah, I do both. So I start from the outside and work in. So we get the skin layers to match up. Then we can get the superficial fascia layers to match up, and then the deep fascial layers to match up, and then the muscle layers. And what we find is that because, as I said before, the fascia attaches to all the internal organs, people that have got, say, abdominal scars, for the sake of argument, can have IBS type symptoms or increased period pains or pain during intercourse, which people don't like to talk about, but actually it matters. And these are things that can be helped with. Incontinence as well. Yeah.
Interesting. Anything else you'd like to mention about scar work?
Scar work doesn't have to hurt. So I use Sharon Wheeler's scar work. It's quite gentle, and I want the experience to be painless for people. If you've had scar work before, different types of scar work that can be sort of very much breaking it down and quite rough, that's not how I work.
No, it's quite gentle. I think I've seen you do it as well, for one, but also because we do share patients, I've seen some come in with gigantic scars, like from operations, and then they've flattened out a few weeks later, which is beautiful, and they're happy with it as well, which is great. You're helping people, because I don't think it's it doesn't come just from obviously the pain of the scarring for the tissue. It comes from also, it is on our bodies, there can be some emotional around it, so like how it's marked our bodies as well.
Very much so. Some people are concerned about the appearance, or some people, it's about that they're worried about wearing a bikini, things like that. The other thing to say about it is it goes on settling, the tissue goes on healing after I've been working with it. So I would only see someone every sort of 2 to 4 weeks for that. And sometimes stitches come out. I've had a stitch come out in my hand. And this is we're talking scars that are years old. So I'm not going to start working on them before you've been discharged, before it's properly healed. So don't panic. But yes, I had somebody who said a stitch had been bothering them for 30 years and it was itching. She could tell it just hadn't dissolved. And it didn't come out during the treatment, but it came out in bed a few days later.
Wow, that's quite healing.
yeah, absolutely.
Good. Right, so I'm going to move on to your next modality, because I think this is my favourite one as well, and Halloween themed as well. So you do what we call bone work. Would you like to have an explanation of what bone work is?
Well, this was Sharon Wheeler again, and she always says she stumbled upon it. She was a rolfer. Long story short, a friend came in with her child with a wonky leg. The lower leg was turned out about 30 degrees. And Sharon said, I can't do anything with that. And the mum just said, oh, you'll think of something. And he fell asleep on the bench with his mum, and she just started to work with it. And it started to move under her hands. So you apply a pressure vector, so you squeeze between your hands quite firmly, but it should be comforting, not painful.
No.
The bone starts to soften a bit like jelly or plasticine. And this is what Sharon was doing. And again, just following it, a bit like you do the fascia, but at a deeper level. And when she inspected the kid's leg afterwards, it was only rotated out about 3 degrees. And she said she actually she nearly fell over.
Oh, wow.
And the mum and the kid woke up. The kid jumped off the couch, and the mum just said, oh, that's better, thank you, and walked out.
Not like a miracle's just happened or anything.
Yeah, I had a lot of faith. So, yeah, I now work with, so who can I help? People that have had fractures that maybe, obviously, again, you've been discharged, it's healed up, plaster casts off, but maybe it's left a bit of a lump, or your finger doesn't quite straighten. Actually, I've been sent a lot of bunions lately. So bunions are where
referring bunions to you.
I feel like the bunion queen round here right now. I had a morning of bunions the other day. But yes, it's a bursitis, inflammation of the sac on the big toe.
Yeah.
But that causes the toe to rotate and the toe next to it to rotate. So what I'm doing is applying those pressure vectors that make the the bones soften and straighten out, because we
Yeah.
think of bones as being so hard, don't we? Like the dog bone or the bone out of the cemetery that your dog dug up. And they're not. They are living tissue, and actually we do have scientific explanation for how it works. It's a chemical reaction that softens the bone, which is quite
So there's
fun.
research behind it as well.
There is. Scar work, we're still looking for it. For bone work, we do know that when you apply those pressure vectors to bone tissue, you get an influx of calcium and phosphate into the tissue. So salt goes into the tissue, and then of course water follows by osmosis, doesn't it? So you get hydration of bone, which is then softened. And then afterwards, over the coming weeks, you get the bone moulding cells start migrating to that area. So which is why I'll say to people after bone work, ideally, I don't want you doing anything strenuous on that leg for about a week, which I know can sound like a big ask. That's going to be delicate now, and that's reforming. So we don't advocate, yes, walk, yes, strengthen it, yoga if you feel like it, but no high impact on a bone worked area for a week after treatment.
No, that wouldn't make sense. Do that anyway.
Yeah.
Right. What do you think about the idea of no pain, no gain when it comes to massage?
So for bone work and scar work, Sharon says definitely we don't want pain.
No.
I think I'm certainly not in favour of traumatising clients. They've come with enough pain already. So I don't hurt people if I can help it. There's often in sports massage, do it harder, do it harder.
Yeah.
It's not how I work. I do accept that sometimes you need to undergo a bit of discomfort in order to make progress, and that in many walks of life, isn't it? So sometimes I may have to do something that will cause some pain, but the important thing is that the client is feeling safe.
Yeah. No, of course.
And that they can say less and they can say stop. Because I don't want people to walk out here feeling wrung out. And it doesn't happen here, but it does happen in some places, doesn't it?
Yeah, unfortunately.
Yeah, we don't want that.
But
so, yeah.
I think that comes with any therapy.
Yeah.
Kind of making sure, but that goes down to like consent and making sure that they feel comfortable with telling you like it is too hard, or maybe stop.
Actually, I've got a new thing that's come from my vocal massage training. It's something else. I've got a new thing now. It's called a consent contract. Will you say if it's uncomfortable or unsafe or just not useful? How will you tell me? And we agree a signal. Because if I'm working in the mouth, which sometimes I will be, you're not going to be able to talk to me. So we agree, will you tell me? How will you tell me? And we agree on that. So we've got a plan if we need to stop or just ease off a bit.
Oh, that's good as well. Because I guess, how would they tell you?
I tend to say, give me, because I can't see, so give me 1 tap on the arm for a little bit less, and 2 taps is a stop. And because it's fascial work, I can't just pull out because that might cause more pain. So it'll be a slow stop. It'll take me a few seconds to disengage.
Right.
And I'll let you know that as well. And I make the joke with the clients, like, if you look at me imploringly, I'm not going to know. I can't see you looking uncomfortable, so you're going to have to tell me that you are uncomfortable.
Yeah. Do you ever hear like kind of like people like wince at all? So that's when you kind of pull off.
Yeah. Oh, absolutely. Or if the breathing, actually, if people have forgotten to breathe or they're holding the breath.
Right, yeah.
So sometimes it's a case of, okay, can you soften the breath rather than holding it in your throat?
Can you breathe for me?
Yeah, absolutely.
Yeah.
Can you keep the breath flowing? Yeah, totally.
Okay, cool. Okay, have you got any interesting cases with either myofascial, bone work, scar work?
I think what I'd add is sometimes the area that's hurting is not going to be always the area that I focus on. So I've had people come in with, I had a lady with a shoulder injury after a COVID jab that went a bit wrong. She'd had breast reduction, so she had massive, massive scars all around her breasts, and I said I'd really like to work with those. And she was very, very reluctant to begin with, but she let me. And now she comes in and asks for it because it helped her so much. And I've equally seen people with shoulder problems that go back to abdominal scarring from a colostomy, and I'm working on that scar, and they're saying, oh, every time you do that, my shoulder's tightening up. How interesting. So when you come to see me, I'm not just interested in the bit that hurts. There is method in the madness.
Yeah.
So bear with me. And sometimes I think that's hard to get across to patients that, yeah, I hear this is what hurts. I'd like to look at something else as well. If your jaw's out, your pelvis is probably going to be out.
Yeah, and that goes down to chiropractic as well, and how we actually assess people. But it's like people come in for a specific, oh, my shoulder hurts, but actually there's a few stuff that's out of alignment that could be contributing and making you walk different, or the way you sit as well. So that's why we like to sort out the whole problem rather than just the tiny problem.
Yeah, why did it happen?
Why did it happen to begin with? Cool. So what's the one thing that people ask us as well, because when I refer people as well, because we've got sports massage and then we have your massage as well, what is the difference between the two?
I mean, I do sports and remedial massage. What is the difference between... I wouldn't call the bone work and the scar work and the myofascial release, it's not really massage, it's body work. So, but often in my treatments I'll do a bit of both. I might start with some myofascial release, and then it's like, actually, yeah, and these muscles are still a bit tight, so let's do some massage. So it might be a bit of both. Some clients are definitely, they come to me for a massage. Some people prefer a woman, and that's okay. Some people prefer a man. Yeah. And that's why we've got two lovely men. Yeah. And we've got me, so you can choose if there's a gender preference, and that might go back to experiences people have had.
Absolutely.
But yeah, I've been in practice, I've been qualified over 13 years. So...
Got quite the experience there.
Yeah, and I might work places you don't normally massage. There's a muscle under the arm that can cause a lot of problems with the shoulder, the good old subscapularis.
Yeah, I was going to say, sometimes that is a killer, the ones that I work with as well. And I pre-warn people, like, this will be tight, because it's one of the hardest muscles for self massage.
You can't, and the psoas as well.
Yeah.
So I might go places that your general massage may not go, and I will warn you first.
Yeah, you have. Considering I've had massages with you as well, but they're really good. They are. Right. So kind of leading back to, how does massage work well with chiropractic? How would you think it does?
I mean, you guys sort out the nervous system and the alignment of the bones, and you do a bit of work on muscles. I spend more times on the muscles and the fascia and the bones to some extent. Yeah. So we have some patients who we share.
We do.
And it can be that chiro or massage was working okay, but bring the other in, and then the patient's suddenly getting a really good result, isn't it? Yeah. So some patients do need, a lot of our patients actually benefit from both.
Absolutely. There's a few research studies as well that benefit more from chiropractic and massage, any type of massage as well. It depends on what your preference is. Yeah. Yeah, so I do normally recommend to people that they see both therapies, but of course in a lovely world I would like to see, but kind of sometimes people just want to go with one therapy, which is absolutely fine. It just may take a little bit longer to see your end result, but it depends on what it is as well. But we'll be here to assess that and see. So I've had people where I'll assess them in a chiropractic way, but then refer them to Sarah, because it will be either scar work, bone work, or just your magical myofascial work.
Or it can happen both ways. Sometimes I might need a bit of scar work. You can't realign someone if there's scars pulling them. If you imagine, I'll do a demo on my clothing. I'll
say, want to take this?
Yeah, to just move the 10 seconds. If you've got a scar, I can do it on my clothing. I'll make a scar and it's pulling that way. Look at the drag line I've created with my cardigan. So you can't align someone until I've released that. So we go in cycles. Sometimes I'll see someone for a bit and then you'll see them for a bit. Yeah. And then of course we do get patients who unfortunately just don't like, maybe have had a bad experience, or they don't like chiropractic, they don't want to be cracked. They want that more gentle approach, and then some people just come to me, don't they? You'll send them straight to me. And sometimes,
I think that is unfortunate, and majority of the time it is where people have had a bad experience with chiropractic. So we can do different types of chiropractic, and we can do gentle chiropractic, but then one bad office visit and that's put them off, and that's fine. We can send you to a different person, different clinician, or different methods. We have loads here, and we can refer out if need be. So it's the good part, well, good thing about being here as well.
Yeah, And also, I think one thing about working with me, because I'm completely blind, I have no sight. People aren't so worried about me seeing their scars. And taking their clothes off. It's pretty warm in here, and most people are quite happy. Obviously, we have blankets, but a lot of people are really happy because I can't see them. I think it liberates them, and they feel more comfortable with me putting my hands on because I'm not looking at them.
Yeah, absolutely. I mean, you are, but you know,
I am.
You're fixing them,
but they somehow the not looking with my eyes at them is less intimidating for some people that are conscious about their appearance.
Yeah, I think when I refer people as well, it's become a subconscious to let them know you are blind. But the first thing they'll go is like, oh, interesting. But going back to, I think I'm just going to add in a little question of a lot of people ask me, have you got more heightened senses due to one being gone?
No, that is a myth. It's a complete myth. So if you give me a hearing test, I'm actually at the poor end of normal. I know, but I can hear if you've dropped something. It's the difference between having better senses and using them better.
Yeah.
So
I'm more in tune.
Yeah, I'm relying on them. But it's a myth to say that I would inherently be better at it because I can't see.
Yeah. Good. Right. And then my last question for you, when would myofascial release be a good alternative to chiropractic? So I know we've just briefly spoke about it, but is there any cases that you can think of?
I think perhaps if there's a lot of emotional trauma.
Yeah.
And chiropractic may just be a bit too much for some people's nervous system. Although I know you do the very gentle McTim stuff, which is fine. If some people just want a bit longer. With me, you do actually get time to lie down, relax. Although you can't go to sleep because I need feedback on what you're doing, on what I'm doing and how it's affecting you. But yes, if there are people that just need a bit more time, would definitely. And I say post-operatively. Definitely see me to do your scar work,
yeah, absolutely,
and your bone work, and then go and see Francesca for overall alignment. We pass people back and forth all the time.
We do, we do, depending on what they need, especially. Because that's our opinion. But
and sometimes it's just personality. With any therapist, like some people will get on better with one therapist than another, and to an extent, it's not about the therapy that we do; it's about what we bring. And some people will gel with you and not with me, and the other way around, and that's okay.
No, absolutely. It depends on, but it's also about like building rapport. But we've all got different personality types, you know. So that's quite a good thing that we have these other people as well, because we can just refer you to a different person, and you might just get along with them better. And then if you do, then your treatment's going to be more effective for you. You're going to feel great as well, and you're going to have a good chat along the way.
Yeah, it's getting that nervous system to a place of safety where you can heal, isn't it?
Exactly.
It's that.
Right, I believe that's all my questions. Is there anything else you'd like to advise the viewers or talk about?
I think just if you've got any questions, do reach out to us. We've got you've got the email, we've got the phone number. Sam is there.
Yeah.
So if you want an appointment with me, though, you may have to wait a bit for it. My diary does seem to get quite booked up.
You are quite booked up, Sarah. So, but it's also a good thing. But that's how good you are, because you are booked up.
Book in advance.
Book in advance.
So you're going to injure yourself. Plan it.
Yeah. Don't plan any sudden injuries. Right. So I think we're gonna basically stop there today, if that's okay. Thank you for talking and explaining everything about scar work, bone work, myofascial work. I hope that has been insightful for you guys as well, and about how it works with chiropractic. So please share, like and comment, and we'll be back again next month. Thank you. Goodbye.